Yep.
Okay. Hey, good morning, everybody. My name is Erin Espinosa, and I'm the Training and Technical Assistance Lead for the Texas System of Care Expansion Planning Grant, or actually Expansion Grant now, at this point. And welcome to our first webinar of this new season. As you can see, we're really excited to get you whipped into shape, so I can't wait to turn it over. But before I turn it over to Robert and Sherry Hammock, who will be kicking off this webinar, I wanted to go ahead and give you some logistical information. So this webinar, first of all, is being recorded, so it will be recorded and be able to be archived on our website. You can have access to it and share it with your community stakeholders as you go forward, probably within, Glenn, what do you think, about a week or so? 2 weeks at the most? Yeah, we'll get it out to you so you can have an archived copy of it. Second of all the materials that we'll be going over today, you can download from the file share pod. You'll see that at the bottom left of your screen. Just click the document you want to download, click download, and it'll go right onto your computer. The third thing we want to share is that if you have any questions that you'd like to address to the participants, the presenters, or even people that may be in the chat box, please put those in the chat box. If you could just type your questions in there, your comments, your feedback, all of that would be greatly appreciated. There will be a question and answer period at the end of the webinar, so if you don't want to ask the questions during it, feel free to hold on till then. But because we don't have the capacity for phone-in capability, pretty much all the dialogue will have to go on through our chat connect. The other way you can follow us is we do have a Twitter feed that will be going on right simultaneous with this webinar, and you can join us in that Twitter feed through hashtag GetFit? Help me out here. GetFit.gov. Right, GetFitGov, not GetFit.gov. That's somebody else. That might be the president's wife's initiative. I'm not real sure. But and that hashtag should be in our chat box. Yeah, at Texas System of Care, hashtag GetFitGov. You can follow us there. And we'll be bringing that information into the chat box as we go forward as well. So with all that being said, I don't want to waste any more time for this great webinar. I'm going to turn it over to Sherry Hammock.
Thank you, Erin, and welcome to this webinar, Whip Your Body into Shape, Strengthening Your Local Governance Body. And my name is Sherry Hammock. I'm the Project Director for the Texas System of Care. I work at Texas Health and Human Services Commission. And so this webinar is brought to you by the Texas System of Care Initiative and the Texas Institute for Excellence in Mental Health at the University of Texas in Austin. And this is really an important topic of interest for new communities as well as tenured communities that are trying to bring together new leadership and partnerships in their community, and in this case for the purpose of improving service delivery for children and youth with mental health challenges and their families. So before I'm excited to turn it over, I want to go ahead and tell you just a little bit about each one of the expert panelists and presenters that we have today. The first one that I want to talk to you about is Ron Tressler, and he's been the CEO at Central Plains, which is a community center in Plainview in the Panhandle for like the last 19 years. And he has been the past president of the Llano Estacado Alliance for Families, which is affiliated with the Rural Children's Initiative, which they are currently a federally funded system of care community. And Ron's going to give us a rural and frontier perspective about operating a governance body. And then secondly, we have Patsy Thomas, and she served as the president for the last 12 years for the Mental Health Connection of Tarrant County. And Patsy was the original president, so she brings a great wealth of expertise and experience in talking to us about their governance body in Tarrant County, which is a past and current federally funded system of care site as well, and she'll bring a perspective of a rural setting, an urban setting to the webinar. And next we've got Michael Cox, and he serves as our system of care team youth engagement specialist as well as the cultural and linguistic competency specialist, and he has a long history of working with youth. And we stole Michael actually from the Plainview, the Rural Children's Initiative community, system of care community, and we're excited to have Michael on our team and presenting today. And then Barbara Granger is also going to talk with us, and Barbara is the lead family coordinator on our system of care team, and she's also the family coordinator at Via Hope, which is a statewide training and technical assistance center. And Barbara actually had previous experience with the Maryland Coalition for Families and Youth, so she brings a diverse perspective. And having daily lived experiences as a mom with a child that has some mental health challenges, she really brings a passion to this work and will talk to us about the family voice. So at this time, I'm gonna turn it over to Robert, and Robert is our community development specialist, and he's going to serve as our master of ceremonies for today's webinar. And Robert comes to us. He's served in numerous capacities on community boards and coalitions with a very diverse array of on governance structures at various stages within the community. So with that, I'm going to turn it over to Robert, and welcome.
Well, good morning, everyone. I'm excited to be here today. And before we jump into our warm-up, we'll start out with a couple of questions first. So we have 3 poll questions we want to ask first, and these questions are just to gauge kind of who's on the webinar and what is going on. So our first question we are going to ask is, and it just popped up on your computer screen, is does your community have a leadership structure in place that works to improve children and adolescent mental health? So if you want, you can go up there and pick which one best applies to you and your community. There's non-existent, did in the past, but no longer does. One is currently being developed. One is developed and is currently assisting children and their families, and then not sure. So we'll give a couple of minutes for that to happen. It looks like we have a lot of people who are voting, so that's good. Hopefully y'all studied for this test. All right, well, we'll go ahead and stop it there. And it looks like a majority of people are currently assisting and developing a local leadership team to assist children and their families. So that's great. So we'll go ahead and move into the second question, which is how many board members are on your community leadership structure? 0 to 5, 6 to 10, 10 to 15, not sure. We'll give a couple of minutes for people to vote. All righty, and it looks like a majority of people have about 10 to 15 board members on their community leadership structure. And we'll jump into the third question. And the third question is, what is your role in your community leadership structure? So do you serve as the chair, co-chair, board member, stakeholder member? And understand there might be a couple of people watching in the webcam, so if you want to, just go ahead and choose which best applies for you. And we'll give a couple minutes, and it looks like a majority of them are still determining what their role is, which is really good and exciting. So thank y'all so much for participating in those questions. So we'll go ahead and jump right back to the presentation. We wait a minute for our slideshow to pop back up. So good morning, everyone. I'm excited to be here today, and I hope you're ready to strengthen your local community leadership team and maybe even sweat a little. As we start with the warm-up. During this warm-up session, we will lay the foundation for the community leadership structure team. So here are definitions for a community leadership team. The first one, which is from the ever-trusty Merriam-Webster Dictionary, and the second one, which I really like, is from the U.S. Department of Health and Human Services. And it has some important concepts such as interagency entities, so a group of community organizations, as well as authorized to make decisions. Now that we have defined it, we'll move into some of the different types of leadership structures. And the University of South Florida put together this great poster, and the website link can be found over in the left-hand corner of your computer where it says File Share. You can see a helpful information resource doc, and you can open that up and that will link you to this. But the research team looked at 14 system of care governance sites and categorized the sites as either a single level governance structure or a tiered governance structure. And in the single level governance structure, there's one interagency, and it governs the system, and there's decision making and funding authority remains at one level, and operates independently of state control. And then as for the tiered governance structure, there is multiple linked levels of governance, usually state to local, or state to county and then to local, and the decision making and funding stops at the top tier, so it starts at the top tier, and the top tier has the ultimate decision, but interagency councils operate at multiple levels. Now that we've looked at some different structures, we'll go ahead and look at who should be involved in your local community leadership team. Well, when identifying and recruiting members to serve on a local governance board, you want to be strategic in the process. And as you can see, there's a list of possible community members. Sometimes we make the mistake of doing the warm-blooded recruitment, which I have done and we have probably all done at some point. And this is where, as long as they have a pulse and are breathing, they can sit on the board. But in order for local governance teams to be successful, we need to stay away from this and recruit community members that will actively contribute to the overall goal of the group. And now, what does a community leadership team do? Well, community leadership teams exist for a wide variety of reasons, whether it's to address and improve a local concern such as children's mental health, develop and review governance principles, bylaws, and practices, or identify and recruit new members, or possibly even help raise money for the group. So these are just to name a few. There's a long list of them. And overall, an effective leadership team is much more than a rubber stamp. So they don't just serve as a group of community members that come together to give their stamp of approval, but yet they work actively together to improve a common cause. Now we'll move into the 7 keys to success in community leadership teams. And these 7 keys to success were identified by the Technical Assistance Partnership for Child and Family Mental Health, and a link to this resource can also be found there in the File Share window where it says Helpful Information Resources doc. You can click on there and open it up, and this will link you to a report they did. And now that we've completed the warm-up session, we will turn it over to the communities to give their perspective on local community leadership teams. I'm sure that both of the communities will include some of these keys of success in their community's stories. Now that we're warmed up, we'll do one more question, and then we'll kick it over to Ron to kick off the exercise portion and provide us with insight on his local community leadership team. So I hope y'all are ready to start working out. And the last question, which is number 4, is what is the highest current priority for your community leadership structure? And we have a wide variety of current priorities there, so if you wouldn't mind, go ahead and click on which one applies best to you. And this is your last test question for today. So let's see, we'll give people a couple minutes to fill them out. And it looks like a lot of people are interested in strategic planning. So that's really good. That's great to see that. So now that we're done with the warm-up session, Ron, go ahead and take over and kick us off into exercising and maybe even sweating a little. Thank y'all.
I don't see my microphone. There it is. All right. I think I'm on now. A little history about the Lana-Estacada Alliance for Family I think is kind of interesting. I understand that the Spanish explorer Coronado, when he crossed this flat, elevated area looking for the 7 cities of gold, which he knew they were not here. But anyway, he named it the Lana-Estacada. And that, as I understand it, means staked plains. And he called it the staked plains for 2 reasons. He needed stakes, number 1, to find his way back across this flat area. It's called the Cap Rock around here. It's about 3,300 feet above sea level, not real high. But anyway, he needed another thing because there was not any landmarks there. Was the reason he had to put the stakes down, but he needed the stakes to tie down his horses as well because there wasn't any bushes there. It's all grass way back then. Well, the reason we went with the Lana-Estacada Alliance for Families is because now we have some trees here, which they didn't have before, and we don't have many trees, but we have a few. So that's like we are here. We don't have a lot of resources here for mental health in this area, but we have a few things. And so that's kind of the background why we called it the Land Estacada Alliance for Families. We changed names when we first started from another name because when we applied for a 501c3, the name we had before was already taken. We meet once a month. We found that if you don't meet regularly, then that, people begin to drop out even more at a higher rate. Our officers serve for 2-year terms, and right now we have a chief juvenile justice as our president. Our members pay $100 dues per year. That's not very much. Now, we just started that in the last year or two. And we were kind of interested in see how people would respond to having to pay dues. And the majority of them had no problem with that at all. At some point, we're going to have to increase that, or we're going to have to take the next step in collaboration. And that is everybody putting some money on the table, taking your hands off of it, and then letting the group decide what to do. We work with ad hoc committees as they're needed, and our priorities are kind of informal. We are really kind of listening, to all the people in the community. We have a big list of stakeholders, and the stakeholders that really get our attention are the family members. And we're kind of like a general store. The old general stores, they had a little bit of everything. Well, we're like that in that we need a little bit of everything. So we are constantly looking and listening for the needs of the community. We have 21 slots on our board. I noticed the highest number in the little warm-up survey was only 15. And sometimes I think the 21 may be a little large. And we currently have some vacancies. And quite frankly, only about half of those 21 attend on a regular basis. But that half attends very faithfully. And we identify our membership by need of, I guess, who's vacant. Right now we don't have a faith-based person there other than as far as a title is concerned or anything like that. We have had, but we no longer have that person. And we look for people who will participate. In other words, give input and have opinions. It's kind of like putting some skin in the game. We really don't need board members who just sit back and do nothing or say nothing and just, I don't know why they're there sometimes. We're made up of family members, consumers, but we have no youth at this time. And one of the reasons that it's hard for you to attend is because of the time of day we meet. We meet from 9 o'clock to 10 on the third Tuesday of every month. Now, our area is 11 counties as far as the community collaborative covers. And we have people drive for an hour and a half one way to get here. And I know youth could participate more if we met in the evenings or on weekends perhaps, but particularly the evenings would work better. But our members would probably not be too interested, from what I understand, in driving an hour and a half one way or 3 hours round trip to attend an evening meeting. So that's a challenge for us. And our highest turnover rate, of course, has been in the membership. It has been the family and the youth for those reasons. And some of the challenges that we've faced, let me advance these things. I forgot to change it. It's been mostly about mental health. And that's good for our agency with Central Plains Center and good for, I guess, other agencies as well who are involved in some form with the mental health. But we have had the Texas School of Nursing apply for a grant using LEAF. We've had some other agencies who have mentioned LEAF or their involvement in LEAF as a community collaborative as they have written grants to show community input. So that's a good thing. And there's thing that I'm kind of concerned about. Central Plains Center, our agency, seems to be the only one who is capable of providing the administrative support. And it's because of our already infrastructure there. And there is one other agency that perhaps could. But all of our agencies except one is, they're state agencies. And so anything outside their primary function as a state agency, they're not able to do. And of course, we have a challenge there with, as I said before, youth and family participation. We have been very successful, like I said in the first slide. We've been pretty successful in finding some resources, for our limited area, and they've been through prevention grants, homeless funds, crisis homeless funds, and we was involved with mental health transformation funds and a system of care agreement with SAMHSA. And one thing that's really taken off with us is mental health first aid promotion. In fact, the funds from the mental health first aid courses that are taught actually finance a lot of our community collaborative efforts on top of the dues. Our communities, I think, benefit from our community collaborative because it maximizes our limited resources. And we become more aware of what's going on and have a stronger working relationship. Here's some things I would suggest for you if you're thinking about a collaborative and forming one. You need people with authority to make decisions at the table. Bring decision makers there. You don't need somebody that has to go home and go back to the office or make a phone call or something to either vote yes or no on something like that. And it's also important to have a strong and influential person to take the lead. I don't mean some pushy, arrogant outfit, but someone who is assertive and can offer some ideas and be willing to take part in those ideas. There's always lots of people in any group of people who will say somebody ought to do such and such. And of course, that somebody is not them, normally in their way of thinking. And another thing I would suggest is kind of get under the wings of, some other successful collaborative. And we did that with Tarrant County Mental Health Connections. And they kind of mothered us a little bit and, invited us over, to Fort Worth and all this and just really, have been available for us. And so, in fact, Patsy was certainly a part of that. And I think it's important to keep your meetings relevant. We try to just keep our meetings at an hour. Now, there's times when we have to go over, but, that's our goal. And if people don't have a meeting where they have good content and they can get something out of it, they're not going to stay interested very long. And I think also your meeting facilitator, your president, whatever you want to call them, they need to be able to handle the meetings very efficiently. It's hard sometimes to control some speakers, but it's or people making reports. But it's very important for that person who's speaking to be guided by a good, competent facilitator. And try to schedule meetings where it's convenient for family and youth, to participate. And we have not been successful in that area at this time. I hope this has been helpful to you.
Thanks, Ron. I think we're turning it over to Patsy now. So Patsy, if you can turn your camera on and join us with your microphone, that'd be fantastic.
Okay. All right, I can see myself.
We can hear you. We can't see you. Patsy, click share on your webcam.
Okay.
There you go. Now we can
Well,
see
I'm
you.
glad to be with everyone today. I see the names of a few friends from over the state. Nice to be with you. I'm happy to share information about Mental Health Connection in Tarrant County, and hopefully you will find some things that can apply to your community. I would suggest, as in most things, that you start at the beginning with the basics. When you come together, when you decide to come together to work on issues in this context about mental health, we started with a vision, and you see what our vision is there, and then a mission. You know, what is it we would like for our community to look like, and what do we want to accomplish? And then everything you do from that point on is guided by these two statements. In our community, our new vision that we implemented with our last strategic plan we just adopted early last year is healthy minds, healthy communities. And then our mission is to lead our collaboration of public and private interest, healing professions, individuals, and families to an exceptional behavioral health system, emphasizing accessible quality care. That's a big, bold mission, but we're working on that and making progress. To give you a little information about our collaboration, I think groups come together for all kinds of reasons, but we organized in late 1999, and as in too many communities in our country, we experienced a tragic shooting at a Baptist church, a youth meeting. A man with mental illness who'd managed his illness for a long time lost his father, and that was kind of his last support system. He reached out really to many appropriate places, and for whatever reason didn't get connected, and the result was that he walked into a church service and killed 7 people before injuring many others and committing suicide. So our mayor at the time actually was the person who approached the mental health provider community and said, can you all come up with some strategies, identify the gaps in services, and why has this person and others fallen through the cracks, and can we plug those gaps and make mental health services more accessible? So that's what we've been doing since then. We are now working on our 4th strategic plan, and the one we created in 2013 was through a search conference process, and there's a lot of ways you can do it. But what we liked about this process, we call it kind of strategic planning on steroids, because we were able to do this in a 2-day period of time. It was a very concentrated period. And we ask ourselves, who in the community is impacted or has the potential of being impacted by mental illness or mental health issues, or who needs good mental health? Of course, the answer is everybody. So we strategically recruited stakeholders from each of the groups that we identified to come together with those who meet with us regularly. And we had about 60 different stakeholder groups, about 125 individuals, and we had many family members with us that day, or those 2 days. And we came up with 7 priority platforms, and these were access, engagement, outcomes, quality, partnership, sustainability, and workforce. And I can go into more details if you all have questions about that. The other overarching themes that we include in our strategic planning that permeate everything would be cultural competence, integrated care, the maximization of technology, innovation, and then our values. And we created values that are much like the system of care values early on in our inception. Logistically, I'll tell you a little bit about how our collaboration works, and you could probably talk to 50 communities and have 50 different ways. I don't think there's any right or wrong way. I think whatever works for your community. And we were happy to get to know people from West Texas, and they've become good friends over the years, and we've actually had others come and visit our community. We have done the same with others. We have found that we love to steal good ideas and to learn from other folks. We have an annual operating budget of our collaboration just to support the infrastructure of our collaboration. It's $200,000, and that's what it's been from the beginning. We've never increased that. Our total budget this year is over $750,000, but the $200,000 comes from a membership dues structure that's a little bit different than what Ron explained. The leaders who organized our collaboration back in late '99 decided that they didn't want to ever put the collaborative members in the position of competing with each other for program dollars to support this new yet one more nonprofit. So they all decided they would put their money in the pot, and so everybody contributes based on their annual budgets. There's a suggested giving level. It ranges anywhere from $300 to $25,000. We have 7 agencies that support us at the $25,000 level. That they've done that since the beginning, and we call them our sponsoring agencies. Many of the agencies that are members don't necessarily give their designated suggested giving level. They do what they can. We have many agencies that are represented by an individual because the agency itself can't afford the $300 or whatever the amount is, and they can join at $30. We have many family members that join at the $30 level. We certainly invite everybody to come. We always say you don't have to pay to play at all, and that's not it's not incumbent that you pay to be a participant. We need the people and the commitment. Right now we have more than 60 agencies that participate with us on a regular basis. If we have special activities that we want to support or do in our community collectively, then we agree to that through several processes. But we have a grants committee that we organized early on that looks at funding opportunities and makes recommendations to our board that whether we will apply or not as a collaboration for certain funding. So we really do try to not compete for program dollars that possibly our member agencies would want. As I said, anything we do, we decide together we're going to do it. And we have monthly meetings, and I agree with Ron. I think it's really important to have a forum for your group to come together. We have those meetings are planned by a membership committee, and they meet every month to determine what the program will be. And each month the program is different, but our average attendance for our membership meetings now is about 70 people, which is amazing. But we use those meetings for education, information sharing, networking, problem solving. It's a great forum to put issues on the table, challenges that folks may be seeing. And I could give you many examples of where where those issues have been presented that we have really impacted some incredible policy changes and ways we do business in the community. We communicate through email and through our website and through our meetings. The monthly meetings are just one meeting. The real work of what we do happens in a series of other meetings, committees, and work groups that we have. We are governed by a volunteer board of directors each year, and Ron was saying that they have 21 members. I think you said, Ron, 2021, and we had about that many for several years, and then a few years ago we had our attorney review our bylaws with us in terms of making sure we were still compliant with everything, and it was at his suggestion that we decreased our voting members of the board to 9, and it has really solved our problem with quorum issues. When you're dealing with the people who run their own agency, sometimes the real work, their paid job gets in the way of the work we need them to do. So we really haven't had a problem with that, and it makes business go a little bit easier. And certainly the decisions they make are based on information that they get from a variety of committees. And when we changed our bylaws, we also went to a process of doing away with all of our standing committees. And each year the board determines which committees are needed for the next year, and that, again, that is based on input we get from that year's committees. And then we will, by resolution of the board, establish the committees for the upcoming year. And there are very specific objectives that are laid out, and again, this is with input from the folks who are doing the work or who intend to do the work or need the work to be done. So it's very measurable, it's very specific. And at the end of each year, we have a way of evaluating, have we made progress? Did we accomplish what we said we needed to do? And in most cases, every year, I'm astounded that we've surpassed everything we thought we would accomplish. we seldom ever fall short of accomplishing what we say. It's also a very good tool in recruiting volunteers because you can tell people exactly what work needs to be done. It can help you identify the skills that are needed to accomplish that work and who you might want to bring in. And many times when people are asked specifically to do a task, they will say yes more often than not because they will know, this may require me to meet once or twice a month all year, or it may require me to meet for a concentrated period of time for a couple of months, or it may be something that we would meet quarterly. Each group determines what their work plan will be. So in each year, everybody's time availability is different. Some years people can take a leadership role. Some years they have to be the Indians. Some years they, can't participate, on something that meets every month, but they could on a limited basis. So I think I'm saying all that because I want you to see the value of having a lot of different opportunities for people to volunteer because everybody has something to offer. I am the only paid staff person, so when I say this is a volunteer-driven organization, I mean it in the truest sense of the word. I direct traffic and everybody else does the work, and it's amazing work that they accomplish. When we need specialized services, very often our members will say, well, I have someone that can do that for you, or, let's talk to this person. And when that's not a possibility, then we will contract for specialized services as needed for as long as we need them. I've told you about the dues structure. Right now we have 31 public and private agencies who pay dues. The others that I mentioned, I told you we have over 60 who participate. And again, many of them may be individual members, but the agencies, we love for people to come to our meetings and participate. We find that the more voices we have, the richer our discussion and the more we accomplish. And we do have one of our platforms in our strategic plan is partnerships, and that particular group is actively looking at a variety of strategies for engaging other stakeholder groups that we see would really support our work. Our challenges have always been stigma. The stigma of mental health. We've done a lot of work in that area, but there's still so much more work to be done. I was very excited to hear at the Meadows Mental Health Policy Institute last week that there seems to be a real desire to work on stigma issues throughout the state. I think that will help all of us. Engagement is sometimes a problem. As I said, certain stakeholder groups that we feel are missing from our group, sometimes we really need their voice, and it's not always easy to get them. We have limited engagement from the faith community. Certainly engagement of family members, youth, always is a challenge. And like Ron said, sometimes it's because of the times we meet, sometimes it's just what's going on in their lives. And we haven't mastered that yet, but we have a whole platform and a strategic plan to work on that. So we hope we can make some progress in that area. When we completed our 10th year, we decided to do a little look back and see what we really had accomplished. And at that time, we were able to account for over $60 million new money that we had leveraged as a collaborative group. This wasn't just new money that any agency had gotten, but things that the collaboration had a hand in bringing into this community to support infrastructure for mental health services. And we did that in 10 years with our little $200,000 a year budget. We're quite proud of that because we could show others in the community that it really pays to work together, that we could do so much more working together than any of us could do alone. We've been very happy that we were able to secure 2 system of care grants. We've been thrilled that we've had the opportunity to work with the state on developing system of care statewide, and that we've been able to share our successes with others as well as learn from others. Right now, we're working on a strategy for creating a trauma-informed community. We've been working on that for several years, but we have a very active strategic goal on that. We've had several social marketing campaigns that have won national awards. One was an anti-stigma campaign called I Am Not My Mental Illness, and another called Friendships Count. One of our family members actually brought to our attention the photographic exhibit Fine Line Mental Health, Mental Illness that was done by Michael Nye, an attorney from San Antonio. If you are not familiar with that, I would suggest that you consider bringing that exhibit to your community. It was a wonderful way for us to put a face on mental illness. We collaborated with our local Museum of Science and History. They hosted the exhibit for us for 2 months. It gave us opportunity to engage a lot of people who didn't want to talk about mental illness. This was several years ago, but it was probably one of the most profound things that we did in terms of raising the bar on discussing mental illness in this community. Over the 2-month period that the exhibit was up, over 70,000 people came through the exhibit. And it's very, very moving, very dramatic exhibit. We can provide information for you. I think it was in Dallas recently, so I know it's still making the rounds. We also created a recognized trauma social marketing campaign that we implemented last year to help educate the community about trauma, why we need to know about it, what do we do about it, what does it look like. Some of our other successes, and I know I'm jumping around, but there's so many things that I just wanted to give you a flavor for the kinds of things that you can collectively do that are outcome oriented, because while we say that our purpose is to come together and plan, and that's true, if we don't have results that we can touch and feel and see and understand the benefit to our community, it's not going to keep us motivated very long. So we have a lot of things that we can point to that we're proud of. Several years ago in our last strategic plan, one of our goals was increasing the number of evidence-based practices among our therapists here in the community. So we did that several ways. We created a 5-year series of symposia called Bridging the Gap between policy, research, policy, and I don't know, I can't remember the other one this minute. And we practiced, that was the other one. We had national experts come in. We did this in collaboration with Texas Christian University. And at the end of the first conference, we created some learning communities in hopes that we could actually keep people engaged in considering adult learning styles, because we know the reality of going to a conference and hearing all these wonderful speakers give you grand ideas, and then you have to go back to reality and deal with your wait list and all those things waiting on your desk. So the learning communities gave us the opportunity to bring diverse groups of stakeholders together. We developed 6 learning communities around 6 general diagnostic areas for children and youth. We thought if we had 5 to 10 people on a learning community that we'd be successful. We ended up with about 20 people on average. They met monthly. Each of the 6 learning communities met monthly for 6 months each. They read a variety of research documents based on their area, and they discussed the relevance of the research to our community, and each was charged with identifying one evidence-based practice that they wanted to bring to Tarrant County. And you see those listed there: TFCBT, CBT, CBMCS is an evidence-based cultural competence curriculum that we found. We created a school-based drug court based on the drug court model for colleges. And then all included research evaluations, because not only did we want to bring the evidence-based practices, but we wanted to create a real value for evaluation and outcomes in this community. And you could see from the platforms of our new strategic plan, that is one of our platforms. We've certainly created that value and include that in everything we do. The cultural connection has formed as a result of the work. We have now trained over 400 staff from numerous agencies in the California Brief Multicultural Scale. We held bi-monthly executive breakfast meetings to share information and talk about innovative ways that we're applying those concepts and those values to the work that we do. Many of our agencies have actually totally redone their hiring policies, many of their procedural policies within their agencies based on what we have learned. Recently, we have learned about mental health needs that are specific to the refugee population. And being in an urban area here in Texas, we have a large number of refugees coming into this community every year. And we are working now on a strategy for meeting those specific, very unique needs that are specific to that group. Part of our CLC work was also with the LGBTQ community. We have a lot of those youth in our community, and there's virtually nothing for them here in Tarrant County. So we've had a forum about that to educate ourselves about it. We're starting a learning community this week to look at best practices and to see how we can better serve that population. And back in November, we brought Dr. Kenneth Ginsburg from Children's Hospital of Philadelphia to town to do our conference for us on trauma as part of our trauma-informed strategy. And he offered our community the opportunity to implement as a pilot a new curriculum that he had developed with the American Academy of Pediatrics called Reaching Teens. And since November 11th, we have our community totally wanted to jump on that and do it. We have over 900 individuals from 13 agencies who will be participating in this pilot, and it's to build resilience in teens. And, adolescent population is one that we haven't focused on so specifically. It gives us a real opportunity to enhance our work with that population as we also move towards a new strategy of working with transition youth. That's another thing that we feel has been a void here. And we'll be working with UNT Health Science Center to do an evaluation of that. So those are just some of the things that I have mentioned. I had other things that I wrote down, but I know I've gone over my time, so would be happy to invite anybody to come visit us. What I think it takes to succeed, in addition to what Ron said, is having that shared vision and mission, and certainly a commitment from the stakeholders. And I do think, as Ron said, that it's really, really important that the decision makers are at your table, and that they are there, they understand that we have buy-in, and that you build consensus. And consensus has to be built over and over, and we have to remind ourselves what we all agree to collectively, and we need to hold each other accountable for that. Communication is a wonderful thing, and it's an important thing. Don't assume that everybody knows what you know. Find out the ways that are best to communicate, and make sure that you're open and that you share information. One thing that we have realized is that I think to be successful as a collaborative group is to always be willing to have those hard conversations. When you have more than two people or even two people involved in any conversation, there's two sides to everything. And you're not always going to agree on a priority or a way to do business. But I think if everyone has a voice, then there's always ways to come to consensus on that. And as I said, holding each other accountable is very important. The shared responsibility is also very important. You will have those leaders that, come forward and, don't wear them out. Don't burn them out. Respect that. A few years ago, and this is one thing I didn't mention in the successes, we created a transformation bureau, and we always try to make things fun that we do, so that people will want to participate. But we asked our agencies to identify people within their organization who they considered up-and-coming leaders, because many times, you need that label of leader, and people that want to be in a leadership role, and then they need the opportunity. So the Transformation Bureau, we actually worked with Georgetown University, who was one of the TA providers for our system of care, and brought Ellen Kagan in to do a 2-day training on leadership, looking at the difference in approaching community issues in an adaptive way or a technical way. And it changed the thinking in our community and the way we did business. It was very transformative. So we gave those 50 folks some real leadership opportunities. And I think everybody leading our platforms today of our new strategic plan we're part of the Transformation Bureau, We also, not only do we have the decision makers and the executives at our table, but we have those mid-level managers, we have the supervisors, and we have people that are on the front lines doing the work. All those voices are very, very important. And I think it's safe to say that our community knows that every voice is considered important. We don't have people coming and being shy. People are willing to engage in the conversations, and we work really hard to make sure that everybody knows that, which is my last, what it takes to be success. Recognize that everyone brings value to it and can help be part of your success. Thank you for your time.
Thank you, Patsy. We really appreciate it. I'm glad you stay around for questions. Now we're going to turn it over to family and youth representation. And Michael and Barbara, you're on.
Hello, everybody. I'm Michael Cox, and this is my cohort,
Barbara Granger.
We're going to talk to you a little bit about youth and family engagement, or family and youth engagement. You've heard from Patsy and Iran how that's one portion that is difficult to begin engaging and knowing how to get them on board and maintaining that, sustaining that. And so we're obviously not going to cover the details of how to do that. That's a whole other webinar. But we will give you some pointers on why it's important to have youth and family at the table, and maybe some strategies on how to get them to the table.
You know, one of the most important principles of system of care is ensuring that families and youth are involved as major stakeholders, not only in tailoring their own individual plan of care, but maintaining that community system of care, making sure that they are involved in the policy development, in evaluation, the strategic planning, everything from social marketing all the way to the system and individual advocacy.
So what are some of the benefits of having family and youth voice on your team? Obviously, it's not to meet grant requirements, but to know that there is definite benefit. These are the people who are recipients of the services being provided, and so their input is valuable. Actually, I'd say go as far as saying golden. The family and youth, they have a unique way of hearing other families, and so being able to connect with other families, being able to work with the family and youth that are involved in your processes, they have that affinity with one another to be able to engage them in the work. Informed parents and youth feel collaborative, not combative, and so we allow that process to come, and we learn how to work together. It's not a combat us and them, it's we. As you've heard Ron and Patsy also talk about the work, everyone's working together to make that happen, and so family and youth involved in that process can help the system to engage family and youth in an appropriate way. So it's not an us and them, a combative way, it's a collaborative effort. And so the decision making as well, that's important to have them as part of that leadership executive team to help in decision making when it comes to policy, management, and those things are going to affect them directly when it comes to them receiving services or being a part of the system. And so them having a voice in that process allows for you to know that those policies and structures that are put in place are going to be effective to the family and youth that come across your organizations. And ensure that the work of the program systems and agencies are relevant and effective. It's one of those things where you think in the marketing community or business community, they usually make their product relevant to the audience that they're trying to engage or to sell the product to. I don't think it's much different in this process that family and youth can help you, organizations or governance board, to determine if what we're doing is our structure, our processes effective to family and youth that are in our community. They can give that voice back to that process. And then also, like the final thing is communities are healthier as the capacities to better support families and youth are enhanced. And so it just allows for a better community, not to mention a better governance structure.
So how do we support the family and youth representation? As you heard from Patsy and Ron, there are always challenges in that. So looking for creative ways to support them, making sure that that you, as a governance board, foster the partnerships among your team members. When a family and youth come into a meeting of people that they probably don't know, maybe one person, if any, it's very lonely, very scary, and very awkward. They don't know what to say. They don't know what they're supposed to say, how they're supposed to feel. They just know they're supposed to be there. So helping, even, assigning somebody with that specific task to help build that team feeling. Also, making sure that you give each family member and youth a specific job role within your governance board, making sure that there's a purpose there. If they don't feel a purpose, then that's where that tokenism feeling comes in. I'm just there because they tell me I should be. So looking for specific ways that you can encourage that and give them roles. Also, making sure that you're providing them the accurate information, giving them extra training, providing training and tasks, so that mentoring, so that they can have meaningful participation. Also, look for opportunities for the family and youth to discuss with their peers all about what system of care is, and so helping them to understand the framework of the whole project is very important. They know it's about mental health. They know it's about families and youth, but helping them to understand the big picture is very important. And then last, you need to consider giving some kind of a stipend for participation. You need to remember that most of the governance board is there because it's a part of their job. But when you invite a family to the table or a youth to the table, they're coming as a volunteer. So helping them, show your appreciation, whether it's a gift card or sometimes it can't be monetary, but if they have to drive, making sure that maybe mileage is provided. Also, you need to remember that sometimes they have to take off from work to be at these meetings if you have them in the daytime. So, and a lot of boards seem to have, they want it to be convenient around their work schedule. So keeping all that in mind when you're enlisting the family and youth. Also, looking for creative ways to even get their participation.
And there is, Bob and I are both available, obviously, to help with some supports and how to make that happen. Maybe look some creative ways to begin looking at time, looking at ways to involve young people and parents and family within your processes, but making sure that that's a consistent effort to make. And then Bob made a great point earlier, maybe it was just when we were talking, but is to know that there's a chance to be flexible in that and looking at different ways to make that happen. But don't give up. Don't give up. Well, we can't find them. We can't get them far. We can't be consistent. Don't give up in that process. Continuing, figuring out ways to try to maybe engage them that's going to be appropriate to your community. and it'll be appropriate to your board, and knowing the times that are there and making sure that's a win-win for everybody. So how to use family youth voice effectively on your team, how to do that. Obviously, policy should be in place to require family youth leaders. So part of your bylaws, your governing structure, infrastructure, should, if family and youth are the recipients of the services, they should be a part of that process. And so it should reflect that down or up even to the policy level. All the governance bodies should include family leaders as well as youth at equal ratio and weight values. And so realizing that, again, Barbara mentioned a while ago that sometimes, you've got paid professionals that are either required to be there or want to be there as a portion of their job. And so looking at those families that bring the value and the youth that bring the value to that governance board, how can we make that happen and that there's equal representation there, appropriate to your governance board. Family youth members are given co-chair responsibilities, so equal leadership, and so not just that, we'll have somebody here just so that we can mark it off, but they have opportunity to help lead and to give direction and to give some guidance to what's actually happening. And then when it comes to planning, when it's looking at the structure of a governance board, or if you're seeking to do to receive a grant or to do something to reach out specifically, that they are part of that creating that process. They are part of the research, they're part of the evaluation. They don't have to just be someone that just sits at a table. They can be engaged in a number of different areas, including research and most different things.
So make sure that when you're looking at providing opportunities for parents and youth to be in front of their peers, explaining the work of system of care and getting the word out there, that you make sure that they're trained so that there's some type of an organizational assistance to help them to know how to respond and to support other families in getting the word out. Also in extracting advice from them. Make sure that when you are training, to apply the family and the youth perspective. A lot of times, not only co-sharing, but as you're giving training to staff members, have that family member or youth there as a co-presenter is a very effective way. Also, looking for coaching opportunities within specific child-serving agencies, in engaging the families and the youth that have been able to find their voice and able to share it with others. So, and remember to look for opportunities for those family and youth to serve as ambassadors to the child-serving agencies. We want to make sure that we don't, that we promote a non-adversarial advocacy. It's not us against them, and so many times family and youth feel like there are so many stresses within their individual care plans, and that it can come across as that kind of perspective, but we want to make sure that it's a we. We've said that several times, and I think it's important for them to feel that they are a part of that team and to be able to effectively use them. And also look for opportunities to support the development of youth and family involvement. A lot of agencies are starting to look for to have youth groups, or organize even utilizing the family support groups within different agencies. So look for opportunities to develop that leadership among the members of those organizations that are already established.
Barbara, as you were talking, that reminded me of give a shout out back to my RCI peeps, Ron and Kay, and you guys that I know are on. Think of creative ways. There was a question in of how are some other ways to get youth participation and maybe for families. Something that we discussed is we hear the word youth, and sometimes we think it has to be someone that's 13, 14, 15 years old, it's in middle school. One of the ways we actually had a young person that was in college that was able to come on and be a part of our governance structure there in Plainview, and had a little bit more flexibility in her schedule, and actually ended up at one point becoming the youth engagement specialist in that project. And so being creative, meaning maybe youth doesn't mean it has to be someone that maybe is that young, and actually, and honestly, my opinion would be is obviously bring someone with a little bit more experience to be a part of that. Being creative with your time and knowing that maybe they can get some credit if they lost class time, or if it's done at lunch, they can take their lunch period working with the school. So there's ways that they can make that happen to help be creative, and maybe the lunch hour of a parent to be able to come and be a part of that. And so I know we did that, talked through that as well when I was in the Plainview area. So there are ways to be creative and ways to get that involvement that's going to be appropriate for your governance structure if a night, a weekend, or another time is not a feasible opportunity for you. So some questions to begin looking at and thinking about how to begin looking at what your infrastructure looks like and what can we do to begin evaluating if this is a value of ours to have family and youth at the table. If you're doing system of care, this should be a value. But what can we do? What are some things that we can put in place? What are some questions that we can begin asking ourselves? And so I'm going to sort of read all those to you, but a few highlights in there is the governance structure ready to answer key questions that family and youth may bring to the table. So those things that may give an outside view or a view from a consumer's perspective, are you ready to answer those? And Patsy mentioned earlier is being able to have those hard conversations. And realize that sometimes what is brought to the table may not be adversarial, but may be a negative, and how do we work together to a better solution? That's part of that partnership. And then our family and youth adequately represented and meaningfully involved in all systems of care committees. And so, that may not be feasible for every committee at every level, but what efforts are being made? How are you communicating amongst between if you have a youth council, if you have an actual member, how are you communicating across those committees to make sure that value is brought to the table, and that it's a definite part of what's happening and what you're doing? And then the other one that I'd like to point out is this: are staff trained in how to engage, involve, and partner with families and youth? To me, that becomes another extreme. You have the preparation, a lot of what Barbara and I do, in helping young people and families be ready to be a part of the system on a system level, provider level, whatever that may be. But the flip side of that is actually determining what are we doing to help prepare the governance structure, the governing board, your system to involve young people and families in your process and your infrastructure. I do remember, again, back in Plainview, we were able to do where our youth actually came in and they did a training for our governance board on how to engage young people. And so being able to have that voice and together to determine how do we work together to make this happen. And I would go as far as to say, if you're not really sure, just ask. Ask those young people and ask the families that are there. And again, Barbara and I are definitely available to help determine those. We both, shameless plug, are statewide developing some infrastructure to help give some guidance and technical assistance to that. There's an adult collaborative, family collaborative that Barbara can speak to, but we're doing a youth statewide youth council that will allow access to young people to help develop that piece of youth guided or the youth engagement within your system.
One thing that I do want to mention is at the very beginning you were asked to fill out, to answer some questions, and one of the survey questions was, what were your key, what were you focusing on right then, and the dominant answer was the strategic plan. We thought it was very interesting that youth and family involvement was either not even on the table or very minimal as far as the voting, which is understandable that your strategic plan is in the forefront of organization, but make sure that you have those families. Don't wait till the plan is finished, but have them at the table helping you develop the strategic plan is very important. Also, having families on the agenda of your, once you get started, let them share their stories. Keep keep that real, help them to feel that's another way to help them feel valued, but also it gives insight into the direction that you may want to go with your governance structure.
So just one question. I know we're at Q&A time, or sort of there, but it was posed by Aaron. So preparing organizations for youth and family voice is important. Yes. There's that level of what we hear in this world called tokenism. Just having a young person or a family member, one, sitting at the table to check it off as we met the demands, is probably more damaging for your system and that person. Make sure that you're ready as a governance structure, that you're ready for what that will look like. And again, it's respective to your governance structure and what is possible for that structure, but that structure is ready for youth and family involvement. Thank you.
So I believe now, Sherry, with questions and answers, I'll help try to pick any out that you may miss. Turning to you.
Sure. Thank you, and thank you all for the great information. It's great to have all those various perspectives, and I really am talking about making sure that there's good use. People are only going to come together when they feel like it's a good use of their time, because all of us are stretched thin, and having people in positions that are decision makers is part of that. And along those lines, Patsy talking about how everyone is valued, really to get that. A couple of other points that I heard is that training and education was very important. Ron talked about using some of those informative opportunities at their meeting, and Patsy said they've evolved into doing the Bridging the Gap conference, and then even shooting off from that, developing learning communities and things of that nature. So that's wonderful communication. And then obviously the bottom line, hearing from Michael and Barbara, the family and youth voice, and making sure that we are on target and that they're in a safe place to be able to provide their input, and that we can hear them and it's received at all stages and at the front end as opposed to an afterthought. So with that, some of the questions, I think I'll start with you, Ron, some of the questions were around the ability for people to pay, and what if they're not able to pay, what do they get for their dues, and around that membership theme. Can you speak to that? I mean, does everyone pay dues, and or are they not allowed in the group if they can't pay dues? So Ron, can you respond to that?
Yeah, I'm trying to see if my mic's on now. It is. No, they can still participate. And we also have a different fee structure for individuals. It's not $100 a year. I forget what it is. I think it's $25 a year. And so, we don't let people, we don't let that stop people from participating. Okay.
Thank you. That's great. And Patsy, I think one of the questions that you had is, and you mentioned that you had an average at your meeting of 70 people. That's awesome. So can you tell us a little bit more about which agencies or organizations are represented on your board, your 9 voting member board, and perhaps how that was determined?
Yes, we did not prescribe in our bylaws which agencies they need to be. So we just, our nominating committee kind of determines that each year, because we have we have 3-year terms for board members, 2-year terms for officers. We do we always have a family member as one of the 9 voting members, and then we also have try to include decision makers from our member agencies on our board. Also, all of our committee chairs, the committees that are established each year by resolution, and we have anywhere from 10 to 20 committees depending on what the workload is that year. All of them are invited to attend board meetings as ex officio without vote, but they all have part of discussion, and our board meetings are open, so anyone who wants to come can. So everybody can have a voice. It's just that we have the 9 voting, but our attorney just suggested that we not prescribe who they have to be. So we just see what our needs are and who's available.
That's great.
To provide the
Thank
leadership
you.
we need.
And I appreciate having worked with you over the years. The evolution of, it was several years. It sounded like into the game for it's like, oh, maybe we need bylaws. So it really started out on a basic level, and people coming together to collaborate, as you said, in response to the tragic event there. But as it evolved, so.
Well, we did have bylaws at the beginning. They were, I guess, kind of evolved from the nonprofit that had been the 501c3 that had been dormant, that we revived for Mental Health Connection. But after a few years, we decided to look at them, and they were a little cumbersome.
I think the last question for you, Patsy, was the on your various anti-stigma campaigns. Were there what were the ways that you were able to say that you hit the mark, that you really were promoting awareness? I mean, how were you able to measure that?
Well, I wish my social marketer was sitting here so she could answer that. We had billboards, we had posters, we had bookmarks, we had ads some PSAs. Depending on the campaign, we had some, for the trauma campaign, we actually had some ads in movie theaters. So we were able to estimate, how many sightings we would have of billboards or bus ads or bus signs on buses or bus benches. You really had to kind of just guess, really, at the numbers. And we knew how many pieces of collateral that we developed and how many we distributed and where they went. So, through our membership, we were able to disperse that information.
Well, thank you for that. And you have done a great job. And I know that with that promotion and training and education, really looking at strength-based ways to do anti-stigma campaigns or to promote awareness is very helpful and very of interest, I think. And Michael and Barbara, I just wanted to give you another opportunity. I think that you mentioned a few, but there was a question, given the fact, and I think someone even proposed that perhaps youth or family can participate in meetings by web or Skype or Google Hangout or something like that with our new technology that we have available to us today. It's for some of us old-timers trying to figure out how to use it. But that may be an alternative. Are there other creative ways that families and youth can participate even outside of an actual meeting that helps bring their voice into the forefront or into the mix of a collaborative?
I think, again, the few that I am thinking of right now is when it comes to looking at your time. And if you have a partnering youth agency or youth group that you're working with that is kind of more giving you feedback and voice to how to engage young people, then maybe some kind of collaboration or communication between the board and that group. To kind of give you feedback, so there's kind of a communication there. So maybe they're not sitting at the table, but there's a liaison between maybe the governance board and that actual youth structure, so that there's that communication back and forth. And taking out, again, knowing what your community has available. Specifically, I know that Ron, there's limited groups out in the Panhandle area as far as to be able to partner with. But maybe looking at church groups or student councils or community youth councils that are already there and partnering with them at the very least to get feedback to what you're doing and what the youth perspective may be. And I heard Patsy mention a while ago that you're looking at the LGBT community and partnering with and kind of building a collaborative around that. Well, that person may not sit on your board, but you have a collaborative effort in addressing that population and how to specifically work with them, and then give feedback to that demographic specifically.
I think it's important to really look at your community and look at the groups that are existing go even into the school for the youth. We talked about the college campuses that might have similar interest, may have, reaching out to them and like Michael was saying, having that, collaborative person, maybe the person that's on the one or two people that are already established on the governance board, having them go out and seek out, focus groups or information. I know working in communities with with different support groups that are out there and helping, seeing if there is somebody that you can pull in to help represent and give that voice from their.
I remember actually a family member, because we're working with the statewide collaborative for youth and actually for our family partners too. And Ron, in your neck of the woods, one of your family members said, our support group, we don't have a mental health support group. We have families that have special needs and autism, or, it's broader. And so to your point, I think, Michael, is that, it may not be in those usual go-to places. You may look, for other, and for people that may not have a mental health challenge themselves, but they're advocating, for someone else as well, maybe great folks to have into the mix. Well, I think that the majority of our questions were answered, and if not, I think we've got contact people with the System of Care team that you can reach out to and follow up. And I just want to say again, thank you to everyone that shared their expertise and were able to be, and those of you that were able to be on the call today. And I'm going to toss it to Erin to talk about the final housekeeping. Thank you again.
Sherry, there was one other question that was posed. Someone wanted to know how you and your community collaboratives engage mental health agencies in general to make them aware that it's a collaborative effort and not a competing effort. And I didn't know if Ron or Patsy could speak to that, and then we can wrap it up if that's okay.
The question is, how do you engage people to be on your collaborative? How do you engage organizations and community members to be on your collaborative? How does that work?
I don't know that my microphone, there it is, okay. I don't know that we have a problem on our collaborative, because I think we're all sharing, regardless whether it's mental health or schools or child protective services, we're all competing, or not competing, we're all scratching around to meet the needs in our community and to fill in the gaps. I just haven't sensed that with
So it's a matter of just reaching out and bringing people into the mix that folks feel like would be good partners? Is that how the engagement works?
Correct. It's people, the people have stayed hooked up and at the table all the time. They have a passion, of course, for what they do, but also for their community.
Thank you. And Patsy, did you want to add your thoughts?
Well, yes, I will say when they first hired me to do this work, the first thing I did was go around and meet with all of the executives of our current member agencies, because there was a little bit of angst that, now that there was a staff person, there was going to be a lot of competition for funding, that kind of thing. So what I did was really get, their impressions of what they thought the value of the collaboration was. And my promise was that we weren't going to do any fundraising. I wasn't in isolation. That I'm just simply the vehicle to do what the collaborative members want. So we've set up a structure to support that. So everybody's totally fine with that now at this point. And sometimes when there are grant opportunities and people are concerned that, we have two competing agencies that want to apply, we'll talk it through and then determine who's going to be the strongest applicant, because we really want that money in the community. And more often than not, our grants that we get in our community, we have multiple agencies doing certain parts of the work, so we tried to build expertise within certain agencies. So we've realized we're really maximizing our resources by not duplicating efforts. So that's one way. The other part is we're looking for new stakeholders. If you look at our list of members, you're going to say, well, they're not a mental health agency. We have our local mental health authority, of course, but then we have the school district. We have Tarrant County Juvenile Services is one of our strongest allies and biggest supporters. And so we always try to, when we approach people about joining us and being part, because we can see the value they could bring to the collaboration, they don't always see it because they think that's not what our mission says. It doesn't say we're a mental health provider. But when you describe what it is you're trying to accomplish and the people you're trying to work on, the behaviors we're trying to change, then the light bulbs
And
go
I think
off,
that is what the public mental health, their mission and purpose, but everyone has a stake in it. So I want to thank you guys for the leadership that you do in your community. And I know that folks there probably say that to you, but strong leadership is key to a collaboration, and I appreciate that. So with that, I'm going to turn it back to Erin to close us out.
Thank you.
Well, thanks, Sherry, and thank everybody. On behalf of the Texas System of Care team, I want to also extend my heartfelt gratitude towards everyone on the webinar today. In the chat box, I have posted several to the closing survey. This will come up on your computer automatically once we close the webinar. If you can complete that for us, that'd be greatly beneficial to our effort. Also, if you want to download a CEU certificate in order to receive LPC, MSW, LCDC, and all those other C-type credits, you can do so at the completion of that survey. One last reminder, this has been a recorded webinar. It will be available on our website within the next couple of weeks, as soon as we can edit it out and convert it and get it uploaded. So we highly encourage you to share that with your governance team at your local level or any other stakeholders that you might want to be a part of. The last thing I want to leave you with is please stay tuned to our e-broadcasts. If you haven't signed up for that, shoot us an email so we can get you involved. We are scheduled to do another webinar in May. We're trying to shoot to have one each month over the course of the summer and into the next year. So keep your topic ideas coming to us. Keep reaching out to us. Let us know what we can do to help your communities. And with that being said, I don't have anything left. I hope you guys have a great rest of the week, and thank you for joining us today.